Hi guys, good evening. Sorry, I was unable to share the screen. I got it now. It was not coming actually. I think because it did not join from the app. Anyway, so today's topic for discussion is actually a large topic, trauma and burns. So we shall be discussing trauma, burns, and a little bit on drowning. These are the three main topics that comes from these related things. So we shall be doing a long case on trauma, a few short case-based vignettes on trauma, and followed by drowning and bonds. So this is the first vignette. So any one of you can. So I think it will be like the other classes of mine on this platform. So one of you just unmute yourself and answer the questions. I shall be reading through the scenario. Just listen to me. So 42 years old man was brought to the ER in an ambulance with a history of fall from third floor. She was on adipiprazole and last 4 days she seemed to be unwell and not very communicative. On arrival, she had a saturation of 87% and 12 liters NRBM, respiratory rate of 28, heart rate of 114, blood pressure 100 by 50, GCS of E3, V4, M5. She had bleeding from the right leg, pain at the back of the neck, chest, legs. The ER team activated a trauma code, secured two large bore IV access, and started a primary survey. So, because this is a teaching class, so I shall also do something. Yeah. So what we can see here, this is a young, middle-aged man who has been brought following a history of fall from the third floor on aripiprazole, and last 4 days not very communicative. So this line is possibly not that important. Okay, last 4 days she going to be not very communicative. This is just a background to this person with a history of trauma. But still, I think you guys have practiced this. It will be like a blank sheet of paper, right? Suppose this is your blank sheet of paper that you will get in your exam day. So you shall divide it into 4 parts. In the first part, the very basics like the age, the history, any comorbidity, these things you shall write in this part. The second part, the basics, vitals. So whatever written here, you should write here the vitals. The third part, any ECG, chest X-ray, any other investigation that they have done, plus any blood investigations. And the fourth part is possible questions. So the possible questions will be, how will you approach the patient? What are the DDs? What are the primary, primary life-saving things that we'll do for this patient? Things like this, followed by investigations, treatment, these things. And as we know, in trauma patient, we can have different questions like primary survey, adjuncts, Canadian C-spine rule, right? And we shall also have the death triad or the lethal triad, and how to manage that. We shall have the hypotensive resuscitation, the blood volume based resuscitations, why the coagulopathy and the metabolic acidosis is bad and how to manage them. So questions like these, and specific traumas like a traumatic brain injury, an abdominal trauma, a spinal trauma, a chest trauma. So things like this. In a chest trauma, we can have a pneumothorax, we can have a aortic dissection and tamponade, and of course the other things like the hemothorax, things like that, or contusions, then massive blood transfusion protocols. So lots and lots of things you can get from question of trauma. So this fourth part is very important. However, if you get some other case like a sepsis case, so these three will be the same. You shall note down the basics of the case, the vitals of the patient, the investigation provided to you, the blood investigation, chest X-ray, ECG, echo, whatever. What cultures have been sent. This I am talking about a sepsis case, and here you shall note down the what cultures, then the sepsis protocols, what antibiotics will you use, what other investigations will you do. So those are the possible questions. Definition of VAP, or I mean, they will not ask definition of VAP, but they will ask something clinically related. So this part is for you guys. The more a person is practiced, the more better they can guess the questions here, because once the questions start after the 20 minutes, then you will have very little time to think, and then you will have to answer those questions. Okay, so that is why this fourth box is very important. So I think by now everybody has got ample time to read the vignette. And here it's a very basic thing. There's bleeding in the right leg, pain at different parts of the body, including the back of the neck, which is very significant, right? And we have started a primary survey. So now the question is, how will you assess the patient? Just one of you unmute yourself and tell me, and then I shall fill in the gaps. Okay? Just let's do it fast, because otherwise we shall not be able to complete.
Okay.
Yeah.
Can I start?
Please. Doctor, please, you can just start.
Okay. Thank you, sir. For this patient who has just fallen from a height and appeared to be polytraumatized, just like you said, the first approach is to carry out a primary survey, which is designed to quickly search for life-threatening injuries using the A to E approach. A is airway assessment. We're looking for any cause of airway obstruction. Then breathe for breathing. We search for any disease process that may be associated with maybe causing breathing difficulties, like we look for pneumothorax, look for pneumothorax or hemothorax, just specifically search out for that. And then C is circulation, which includes stopping that bleeding that is ongoing in his limbs. And then, of course, assessing the circulation for hypotension. Okay, and D is for disability. In this case, we are specifically looking for signs of serious illness like head injury, where the GCS is quickly assessed. And then E is we try to look out for other occult injuries that may be life-threatening, like maybe bleeding from the scalp or any other place. This would be the primary survey that to be carried out. And while its effect is detected, is treated immediately. That's in terms of resuscitation. If he's seen to have maybe airway obstruction, it is suction is applied to suck out maybe blood clots from the airway, and then ensure that the airway is patent and that he's breathing. If respiration needs to be supported with maybe the ambu bag, it is given. Okay, and if there is any impairment in respiration, say from pneumothorax, that will require immediate decompression, it's undertaken. And then from the circulation, we may need to, increase, give some fluids if there is hypotension, at least ab initio, and so on. And bleeding spots will need to be secured immediately, maybe with pressure dressings. So this is how I will approach this patient in the course of the primary survey.
Okay. So basically, whatever you said is absolutely correct, but we have to touch a few more points. So first is the primary survey, as you told. So A, B, C, D, E approach. So we have to be very pinpoint. So here for airway, you shall see whether there is an obstruction from bleeding or any tracheal injury. Then breathing, yeah, you should see the respiratory rate, the respiratory pattern, and you should also do a POCUS, bedside POCUS, to rule out any pneumothorax or any obvious large collections. Then you shall circulation, apart from the pulse, blood pressure, you shall be doing a volume assessment, and in the POCUS you shall check for any cardiac tamponade and the basic ejection fraction. Then finally disability, and you shall of course remove the clothings and everything to check for any fractures, any bleedings, any pelvic, any obvious pelvic any any pelvic injuries. And you shall also be looking at what you should also looking obviously for the GCS, because GCS and the back of the neck for any any pain. As I mentioned here, this pain and the patient has fallen on third floor. So that part is very important. So this is what you shall be telling in the ABCDE approach. Apart from that, you shall be you shall be arranging for blood products, and the patient is in the ED, right? So you need to tell where you shall shift the patient, or you shall do something in the ED itself or not. You shall have to go for an EFAST, right? Fall from the height. EFAST and a multidisciplinary team, including the the emergency team, then the surgeon and the orthopedician, they need to be consulted. And finally, fifth is if you feel that the patient, because the patient has got what bleeding from the right leg, so this needs to be assessed. So this needs to be assessed, and there is also pain at the chest and the legs. So the POCUS, the EFAST, then CT scan, all these things are very important. So those the investigations, those you need to mention. So it's not like you have to mention it in this order, but these things you need to mention whenever you get a case of trauma. And yeah, you can, of course, all of these are mostly included in the ABCDE approach, but these specific things, blood products, EFAS, CT scan, multidisciplinary team, and investigations, you also have to tell.